Tonight on the Pix 11 News at 10, a cutting-edge treatment that makes cancer disappear.
Incredible moment. We had chills.
But the potential cure comes from a once deadly virus. How is this possible? Pix 11's Marvin Scott looks at a new hope for cancer patients from the most unlikely source. Tonight on the Pix 11 News at 10.
A potential breakthrough in the fight against cancer, all thanks to the once deadly HIV virus. Thanks for sticking with us tonight. I'm Tamsin Fidel.
And I'm John Muller. Millions of lives have been claimed by both, but now one is being used to cure the other. Researchers astonished to find that they can use a form of the HIV virus to make certain cancers disappear. Pix 11's Marvin Scott joining us now in the studio with more on this special treatment. Marvin.
Well, John Tamsin, the medical and pharmaceutical community is watching with great interest the promising results of the experimental therapy being administered to cancer patients for whom there had been little hope. They were scientific guinea pigs for an untested treatment that involved the use of the once deadly HIV virus. The AIDS virus, the killer of millions in the 80s, is now saving lives of cancer patients, like this 10-year-old girl and this 70-year-old retired corrections officer. Medical researchers have found a way to genetically alter the deadly virus to treat patients with forms of leukemia.
The virus has been engineered so that it can't cause disease anymore, but it still retains the ability to reprogram the immune system so that it will now attack cancer cells. Each infused cell can kill more than 1,000 different tumor cells.
Dr. Carl June, who heads the research team at the University of Pennsylvania's Abramson Cancer Center, has been conducting breakthrough clinical studies since 2010 that could be a turning point in the development of effective gene therapies against cancer. It is bringing hope to patients who had lost all hope, patients like Bill Ludwig.
No cancer anywhere in my lymph nodes or my bloodstream or my bone marrow. It's gone. And it's been gone since September of 2010, over 5 years.
Before becoming the first patient to join the experimental clinical trial, Ludwig had undergone 10 years of chemotherapy and other treatments without success.
There was no anxiety because I had already accepted my demise. I just felt I had nothing to lose. I was done. I was hoping to see Christmas in 2010. That's what I was hoping to do, spend one more Christmas with my family.
Ludwig's oncologist, Dr. Allison Lauren, was reassuring as the New Jersey grandfather courageously allowed his own T cells, which is a type of white blood cell designed to fight infection, to be reprogrammed with a modified HIV virus.
We start by taking the white blood cells, we remove those from the patient, and then we take those T cells back to the lab, infect them with this modified version of HIV that's now been reconstructed.
10 days into the pioneering experiment, something appeared to go terribly wrong.
All my organs in my body started to shut down.
The apparent setback turned out to be part of a positive transition. Ludwig's body was trying to remove waste that caused his systems to shut down. But in a matter of days,
the high fevers started to go away a little at a time. Blood pressure came back.
All of his lymph nodes were smaller or gone. His spleen had shrunk. His blood counts were recovering back to normal with no evidence of CLL in them. And his bone marrow biopsy had no evidence of cancer in it either. Incredible moment. We had chills. It was remarkable. It was truly remarkable.
I asked God to give me the strength to fight this disease. I said, you don't have to cure me. Just give me the strength to fight to my last breath. And now I am cancer-free.
The altered HIV cell therapy has seen impressive results among children, with now 10-year-old Emma Whitehead becoming the poster child for the radical new treatment of acute lymphoplastic leukemia. She's been in remission for 3 years now.
How you been feeling?
I've been feeling quite well, thank you.
Every time I saw him, still no cancer. Bill asked me, how long is this going to last? And I said, I don't know how long it's going to last. You should enjoy every day.
And in doing so, I play golf at least once, twice a week, and I go to various vacations in my new RV, and I'm enjoying my grandchildren and my family.
He certainly is. All very remarkable. Now, Bill Ludwig, who was suffering from chronic lymphocytic leukemia, is among 14 patients involved in the initial phase of the clinical trials to respond favorably, with others like him in remission now for more than 5 years. Even more extraordinary, 90% of some 40 children with leukemia involved in the tests, they're now showing positive results. And researchers are very hopeful that someday this experimental therapy will be in wide use to help eradicate many forms of cancer. John Thompson.
Just an incredible story. Marvin, let me ask you something. Is it possible it will be used to treat other types of cancer we're talking about when we're looking at breast cancer, we're looking at stomach cancer? Is that a possibility?
Well, that is their hope, and right now they are involved using this therapy in testing other forms of cancer, including pancreatic, ovarian, brain, and other forms of blood cancer. So there is some promise on the horizon.
Remarkable story, Marvin. Thank you.